you're having pain in the front of your hip with prolonged sitting or cycling or any exercise, maybe yoga, where you're bringing your hip up and across your body, and that's creating typically kind of a dull ache at first, and it can become sharp and pinchy in the front of your hip. So what is going on? Well, it could be femoral acetabular impingement. So what is femoral acetabular impingement? FAI sounds like a big word. Well, essentially it's your femur impinging, compressing on your acetabulum, which is your hip joint. And so any motion where you bring the leg up and across, so go ahead and just cross your legs like that. So anything where this knee is across, even if this is all the way down where it's just like that, it's still bringing your leg across and up, and that will cause impingement in Tate's left hip here. So one of the other things we find, go ahead and lay on your back, is that it's not that you would do this regularly, but we find that when you bring this leg up and you internally rotate just like that, and especially if you come across, if you're getting pinching in the front of your hip, that's most likely femoral acetabular impingement. So that's a compression of one bone on the other, and in that hip joint there is a labrum, a rim of cartilage around there, that when that hip impinges, it compresses on that labrum and can tear that labrum. And that can cause all sorts of pain and discomfort also. In order to best assess your anterior hip pain, the front of your hip, to figure out if you've got femoral acetabular impingement, is to take you through first range of motion. So we will use orthopedic tests particularly to bring your knee as far up as we can and internally rotate and try to define the boundaries of where you're getting impingement or compression in the front of your hip. So we would also use range of motion testing for your low back and hip joints to figure out where are you restricted and where are you normal, so that we can figure out what movements need to increase range of motion and which ones are just fine and don't need to be changed, as well as where you're strong and where you're weak, because oftentimes with FAI, femoral acetabular impingement, people are deficient in hip extension, and that lack of extension causes a slight shift in the joint and causes increased compression in the front. So we will be looking for all those and try to rule them in or out during your exam to best assess you. So once we have a full assessment and we've done a neurological test to make sure you're not having any symptoms from your back, then we can formulate a solid diagnosis and create a treatment plan. Once we have a solid diagnosis, then we create your treatment plan customized to you. So that will include, in the office, we will do soft tissue work all around the hip, so especially psoas and iliacus, the hip flexors in the front, your lateral hip piriformis, a lot of the muscles just all around the glute, sometimes in your back also. But one of the hallmarks of femoral acetabular impingement is just to stop impinging the hip. So we will have you change your sitting position, sometimes for short term, sometimes forever, depending on what's called your bony morphology, what your bones look like, right? If you have growth of your hip joint such that it grows out like that and you don't have the range, then you're going to be very predisposed to femoral acetabular impingement. If you aren't built that way, then we can probably just get you out of pain and you'll be fine for a long time and not have these symptoms again. But it just depends on how your hip is built, and we would assess that on x-ray. And usually we only x-ray if you're not making progress, so we don't have to x-ray everybody, but it's definitely a useful tool if needed. So those are the types of things we would do in office, where we would do soft tissue work. But also out of office, we would have you do a home exercise program where you are loosening up the muscles, doing stretches to the muscles that are tight and strengthening to the muscles that are weak, which is usually glute max, hamstrings, things like that, that are muscles in the back on the posterior. So if you're having anterior hip pain with sitting or anything where your knee is coming up and across, give us a call. We'd love to help.